Hello, I'm Dr. Hanson with Hanson Chiropractic and Injury, and tonight I'm going to be working on Mike. Mike is a long-term patient of our office, and today this is really going to be geared towards people that deal with instabilities in their lower back. People that feel like their back, quote-unquote, goes out and locks up, and it creates a lot of pain. Mike had a really severe fall about 20 years ago.
February 21st, 2001.
Yeah, so long time ago, and he was a patient of our office at that time. He fell about 5 feet, landed on his hip. It was a work injury at that time, and he damaged several of the ligaments. I'm going to talk about that as we start to work with him, and I'll kind of walk you through how we handle a real severe instability in the low back, and you can see what this looks like. So, Mike, if you want to go ahead and lay on your stomach face down. And so, typical for Mike, go ahead and squeeze your knees together and then relax. And so if you want to take a look here, this is typical for Mike. It's what we call a Deerfield test. If we look at his heels, you can see that right leg is short by a good, really about an inch. And you can come in on this side and take a look this way. When I bring his legs up, you'll see that how short that is on that right side. What happened is when he fell, he damaged the sacroiliac ligament, which is a ligament inside the sacroiliac joint. And it's not often that gets injured, but kind of one-sided hip-type falls can do it. He also damaged the iliolumbar ligament, and that has caused a lot of instability in his lower back. So I'm going to be taking through the process of getting him leveled out, getting his pelvis back in line so this whole right side can move. Right now, this is all jammed up and not moving at all because of those angles that we talked about, okay? So in his case, what I found to be helpful is we'll start by doing some traction on his right leg, and it's pretty vigorous. I need to give a really good, strong pull, just like that, okay? And you can see right away, that pulled, about a ½ inch out of that asymmetry in his leg lengths. So we're on the right track. The next move I'm going to be doing is we're going to be using a drop piece. I'm going to be working on that right sacroiliac joint. In his case, his right SI joint goes posterior. In other words, it goes back and down on the right side, and his left side goes up and forward, what's called anterior and inferior, or superior, I should say. So I'm going to be working on bringing that torque out of his pelvis, okay? I use a drop piece to do that, and my hand placement's really important. Yeah, he kind of breathes out, relaxes, and I kind of find a time where his muscles let go, and then we drop in really quick. So I got a really good release there. Feel that, Mike?
Oh, yeah.
Yeah, that was a really good release. I'm just going to drop one more to reinforce that. And then, now, look at that. So that leveled him right out. I mean, I felt that whole joint let go where he was rounded up on his right side in the pelvis. This is now leveled out, his left side, so he's more symmetrical through here. The next thing I'm going to do to reinforce the way that I just adjusted him is I'm going to have you go ahead and lay on your left side down there, Mike, and face towards me. And this is a side posture adjustment. And sometimes with Mike, I'll get additional movement here. Sometimes I don't. But I find that it helps to just free that joint up and get him moving a little bit better. Again, just real easy and quick through there. Let's go on your other side there, Mike. And then here, now as an example, you saw me adjust him on his other side, on his right side. I'm going to adjust him on his left side. It might look the same if you weren't really knowing what you were looking for, but actually my contact is different. I'm actually contacting the lower SI joint here, and I'm driving down and forward, whereas on the other side I was driving up and in on the upper part of the joint, okay? So it's a different move, even though it looks real similar. Here we go. Let's go ahead and lay on your back here. Good. Now what we find is after that, boy, the rest is pretty easy for Mike. just adjust his mid-back. Yep, let's sit up here. There we go. Good. And his mid-thoracics move really well. I'm usually working in his lower neck, right where the lower neck meets the rib cage, right here at C6, C7, T1. And I like to get in right where that first rib intersects. There you go. And that just helps to free up a lot of this rotation that starts in his low back and goes all the way up, okay? Let's go back on your stomach, face down. And I'll have you go ahead and squeeze your knees together again there, Mike, and then relax. Okay, so this is excellent, okay? So you might remember when he started, his right leg was a solid inch shorter than the left leg. And the reason for that is because his right sacroiliac joint had slipped superior and inferior. So they're basically twisted up and back on the right side and forward and down on the left side. And what I did to adjust just now is I unwound that, and now he's leveled out. This joint is all freed up. When Mike originally was injured, he damaged the joint, the ligament on the inside of the SI joint, and then one of the ligaments down here at the very base of the back. Another thing that we had to do in his case, I referred him out to a physiatrist who specializes in what's called prolotherapy. Prolotherapy is essentially they're injections that help ligaments to heal. This is not like cortisone. These are actually sugar compounds that help the ligament to heal and stimulates it to be able to heal. That has made a huge difference in his case as far as giving him stability. He's also incorporated physical therapy. Initially, when the injury first happened, massage therapy was critical to work through this whole process. And then we also found that wearing what's called a trochanter belt. Now that's a belt that actually wraps around his pelvis and essentially kind of squeezes and holds him stable right through here and provides a little bit more stability that normally our ligaments would if they were in the normal shape and not damaged like they were in his case. He will always have a certain amount of damage to those ligaments that creates laxity in that right sacroiliac joint. So we fitted him with a trochanter belt that basically gives a little bit more support, and he wears that, and that's been a tremendous help for him. By doing all of this, we've been able to keep his back stable. He requires ongoing adjustments just on a regular maintenance type basis or supportive care basis. But it allows him to be able to fully participate and to be able to work and to do all the things he'd like to be able to do. And that's just something that would not have been possible without the right kind of rehab following that injury. It was a really significant injury. So, Mike, I'll have you go ahead and come on up. And then lastly, I always like to check. He works at Boeing, so he has a lot of repetitive trauma to his wrists, elbows. Yeah. So we work through those joints also. Good. That's it. Good. Okay. So hopefully that's been helpful. It's a great example of lower back instability. If you know somebody that's been having chronic low back pain, perhaps they've had an injury in the past and they have that feeling like their low back is constantly going out on them. They have periods of acute pain and other times where it's holding pretty well. Give us a call. Often we can really help with those type of issues. Anything you'd like to share, Mike?
It takes a lot of hard work, and with the type of injury I had, there wasn't anything that wasn't painful that did really any good. It was almost funny. It wasn't a very fun way to go, but everything is, when you get an injury like this, you have to work through it. You can't take any shortcuts. It really isn't very wonderful, but if you work through it, you can get better.
Yeah, right on. That's really good advice too. Thank you. I appreciate it. And so as always, we'll keep in touch, and you can always find us at everettpainrelief.com. Thank you very much.